Okay, I want you to just think for a second about how we've traditionally viewed getting older. For decades, the whole cultural narrative has been pretty simple and honestly kind of depressing, right? It's this idea that aging is just a one-way street toward getting physically weaker. We've kind of just accepted it as a fact of life. But today, we're diving into some totally groundbreaking clinical guidelines that literally flip that entire narrative on its head. We're going to look at some hard clinical evidence proving that age-related decline is absolutely not a life sentence, and that we actually have the tools to rewrite the rules.
So here's our roadmap for today. We'll start with the reality of frailty, then we'll analyze the evidence. From there, we dive into the two big pillars, nutrition and physical activity. We'll look at the power of combining them, that synergy, and finally, how we can actually overcome real-world barriers to make this happen. Let's just jump right in.
Starting off with Section 1, the reality of frailty and why it's a growing vulnerability. We really need to start with a massive paradigm shift. The clinical practice guidelines state it flat out. Frailty is not an inevitable part of aging. I mean, think about how deeply ingrained the exact opposite idea is in our culture. We almost universally equate having gray hair with being fragile. But this statement completely shatters that myth. Now, frailty is for sure a major public health concern, but the key takeaway here is that it's just not written in stone. Getting older doesn't automatically mean you have to surrender your strength.
That being said, we do have to face the facts as they stand today. Right now, 1.5 million Canadians are considered frail, and with our rapidly aging population, that number is projected to surpass 2 million in just the next 10 years. But let's bring that down to earth for a second. 2 million isn't just some abstract statistic on a spreadsheet. Those numbers represent our parents, our neighbors, and, eventually us. It's a huge chunk of our society facing a way higher risk for things like falls, hospitalizations, and just a sudden loss of everyday independence. So, we need to be really clear about what we're actually talking about here. Frailty isn't just, being old. It's clinically defined as a state of increased vulnerability where your body literally has less capacity to resist stressors, and that's due to a decline in reserve and function across multiple physiological systems. If that sounds super clinical, just think of your body's physiological reserve kind of like a smartphone battery. When the phone is brand new, the battery easily lasts all day, right? It can handle a dozen apps running at once. But as it gets older, that reserve shrinks. Suddenly, opening one heavy app drains it to zero. In human terms, a low reserve means a minor bump in the road, like a mild infection or a tiny fall, can cause a massive, cascading system failure. Now, there is a super crucial distinction between being fully frail and being what we call pre-frail. Pre-frailty is this multi-dimensional risk state that shows up before actual frailty develops. Think of it like that yellow check engine light coming on in your car. It's that critical moment where you can still pull over and fix the problem before the whole engine just gives out. It's a dynamic state. Yes, it can definitely get worse, but critically, it can get better. Intervening during this golden window is literally the single most effective way to preserve someone's independence and quality of life.
All right, moving on to Section 2, analyzing the evidence, how we know what we know.
Before we start throwing out solutions, we really need to look at the science behind these guidelines, which were brought together by experts like the Canadian Frailty Network. Because let's be honest, we live in a world absolutely overflowing with internet fad diets and confusing, contradictory medical advice. We need absolute credibility. These researchers didn't just guess or go off anecdotes. They used something called the GRADE framework to rank the evidence from two massive systematic reviews. GRADE basically translates really complex clinical data into actionable certainty. It tells us exactly how confident we can be that a specific medical intervention, like changing your diet or doing a specific workout, will actually produce the promised result out in the real world. Okay, Section 3. Let's look at Pillar 1, nutrition. So, this is our first major intervention pillar. Nutrition is where we start building back that depleted physiological reserve we talked about earlier. The guidelines give a really strong recommendation to optimize daily dietary intake. Specifically, they're talking about adding protein-fortified foods, using commercial nutritional supplements, taking vitamin D, and just generally tweaking diets to make every single bite more nutrient-dense. And why is this absolutely crucial? Well, as we age, things change. Our metabolism slows down, our appetite decreases, or maybe dental issues pop up, all making it way harder to get what we need from regular meals alone. The evidence shows with moderate certainty that actively fortifying your diet improves muscle strength and helps you tackle basic daily activities.
And what's truly fascinating here is the biological mechanism at play and just how accessible these interventions can actually be.
For example, secondary research shows that pairing a specific nutritional choice, like eating protein-rich Greek yogurt, with a 12-week high-impact loading exercise program directly increases bone formation. It's incredible. It highlights this core principle of human biology. If you give your body the exact right building blocks and then put it under the right physical demands, you can literally force your body to make profound structural improvements.
Which bridges us perfectly into Section 4, Pillar 2, Physical Activity.
So building on that idea, we need to focus on the specific types of movement required to reclaim that physical reserve. Based on moderate certainty evidence from thousands of participants, building an exercise routine step by step is absolutely vital. Step 1 is aerobic work, like walking, which is great for overall mobility. Step 2 adds muscle strengthening, and the evidence shows this actually reverses the severity of frailty. Step 3 brings in mobilization and rehab to really challenge balance and coordination. But Step 4, that is the absolute gold standard. Multi-component training. I mean, going for a daily walk is fantastic for sure, but it's the deliberate combination of aerobic, resistance, balance, and flexibility training that effectively tricks the body into turning back the clock. It has a massive, clinically proven effect on reducing frailty.
Now for Section 5, the power of synergy, the ultimate prescription.
So we know that proper nutrition gives us the essential building blocks, right? And we know that multi-component exercise tells the body exactly how to use them. But what happens when we put those two together? When we look directly at the clinical guidelines, a super clear winner emerges. The single strongest recommendation for older adults dealing with frailty or pre-frailty is the powerful synergy of combining physical activity and nutritional strategies. Focusing on diet alone? That's good. Focusing on exercise alone? Also good. But merging the two, that is where true, measurable transformation actually happens.
And that brings us to Recommendation 8, which honestly is the ultimate takeaway of this whole explainer. Combining diet counseling, targeted fortified foods, and multi-component exercise leads to tangible reversals in frailty severity and huge improvements in overall mobility. The clinical evidence proves beyond a shadow of a doubt that frailty is a dynamic state. Aging is no longer this one-way street of inevitable decline. We literally have the biochemical and physiological roadmap to reverse it. And this isn't just about adding years to someone's life, it's profoundly about adding vibrant, capable life to those years by reclaiming physical independence.
Finally, let's look at Section 6, Overcoming Real-World Barriers.
Because, let's be real, having this scientific roadmap is only half the battle. If we want to proactively manage aging across the population, we have to honestly confront the real-world barriers that stop older adults from getting this kind of care. There's a massive, glaring systemic issue here. How can we expect patients to get better when a lot of health systems don't even formally recognize frailty as a distinct medical condition in the first place? When doctors miss the chance to systematically identify it, the whole treatment pipeline just stalls out. Add to that the high financial costs, the sheer lack of access to specialists like dietitians or kinesiologists, basic transportation issues, and the really complex reality of managing existing pain and other health conditions. It's a lot to overcome. So, what's the solution? Well, it requires a fundamental, systemic shift in how we deliver healthcare to aging populations. Healthcare providers absolutely have to move past just handing out those generic eat well and exercise pamphlets. They need to systematically assess frailty using validated tools and then write highly specific, tailored prescriptions. Instead of just vaguely telling a patient to go for a walk, a doctor needs to prescribe 20 minutes of resistance band training paired with a whey protein shake based entirely on that specific individual's goals, cognitive status, and functional ability. It has to be personalized.
Whether you're currently looking out for an aging parent, advocating for a patient, or just planning for your own future, I want to leave you with this vital thought. Frailty is not a rigid endpoint. It's a dynamic, completely reversible state. But as our global demographics shift and our populations grow older, how will our healthcare systems adapt to systematically recognize and reverse frailty before it's too late? Thank you so much for joining me on this explainer. Keep learning, keep moving, and we'll see you next time.